Hello everyone, my name is Mallory McDowell and I have chosen lifestyle modifications in type 2 diabetes for my master's project. I chose this topic because the disease is so prevalent in our population today and I have multiple family members affected by it. We know that prevention is key, so my goal was to learn all I could about different ways to encourage my patients to be proactive when it comes to their health. Type 2 diabetes is one of the most common chronic conditions in the United States and is currently the seventh leading cause of death. In the last 20 years, the number of Americans diagnosed with diabetes has more than tripled due to the increasing obesity epidemic. There has been an increase in the number of people with prediabetes as well. So what does this mean for us as future providers? Each and every one of us will come into contact with someone who has diabetes no matter what specialty we end up in. With that being said, it is important for us to provide our patients with as much education as possible in order to help them live a healthier lifestyle and maximize their quality of life. This disease occurs as a result of peripheral insulin resistance, with obesity being the most significant environmental risk factor. With that being said, implementing lifestyle modifications early on with our patients is so important to reduce the risk of complications. It is also important to intervene early with our pre-diabetic patients so they don't reach the point of requiring medication. While not all factors for diabetes are modifiable, it is important to help our patients take control of their health by maintaining a healthy diet, a healthy weight, and making adjustments in their diet. As with many diseases, diabetes may present differently in various patients. Some patients may be symptomatic early on, whereas others may not present until their condition has been slowly progressing over a longer period of time. The most common symptoms associated with diabetes are polydipsia, or increased thirst, polyuria, or increased urination, and less often polyphagia, or increased appetite. Some patients may be diagnosed by incidental findings on routine lab work or have visual changes in more advanced disease. A sign commonly associated with insulin resistance and often found in the obese population is acanthosis nigricans, or hyperpigmentation found in skin folds, especially around the neck. There are multiple lab tests used to diagnose a patient with diabetes. The one most commonly associated with this disease is the hemoglobin A1C. This test measures a patient's average glucose readings over a 3-month period. A level of 6.5 or greater is diagnostic. We may also use a fasting plasma glucose, where a level of greater than or equal to 126 would be diagnostic, or a random plasma glucose or oral glucose tolerance test, where a level of greater than or equal to 200 would be diagnostic as well. To make an official diagnosis of diabetes, you must have two elevated levels from two different tests or an elevated random plasma glucose greater than 200 with the patient experiencing some of the symptoms mentioned in the previous slide. There's no imaging necessary to make a diagnosis. Lifestyle modifications is the mainstay of treatment for type 2 diabetes. We should educate and encourage all of our patients about the importance of smoking cessation, eating a well-balanced diet, and making physical activity a part of their daily routine. The CDC recommends that adults get a minimum of 150 minutes of moderate intensity exercise each week. We should encourage our patients to start small by making little changes in their day-to-day life, such as making a point to get up and walk around more and decreasing their amount of time spent sedentary. If we start with smaller goals and work our way up, our patients will not be overwhelmed and are more likely to adhere to our treatment plans. We must encourage our patients to find the activity that is right for them, whether it be group exercise classes or simply walking at home. As far as diets go, we should be readily available to counsel a patient and give them resources to assist with their meal planning and guiding them in the right direction of changing their eating habits. One diet that we may suggest is the DASH diet, which increases the amount of fruits and vegetables and limits sugars. While some patients may be able to control their diabetes with lifestyle modifications alone, many of our patients will need medication to help lower their blood sugar. Metformin is often the first-line therapy for patients newly diagnosed with diabetes, and even some of those who are currently at pre-diabetic levels. As with most diseases, the treatment regimen will not be the same for all of your patients with diabetes. Some patients will be controlled with metformin alone, while some will require the addition of another class of diabetic medication, such as SGLT2s, GLP-1s, or DPP-4s. Some of your patients will also likely benefit from insulin therapy at the time of their diagnosis, as studies have shown it to be an effective first-line treatment in some cases, as well as a good option for a combination therapy in uncontrolled patients. Prevention of diabetes is key, so remember to implement lifestyle modifications with each and every patient so that together we may help some of our patients avoid this disease or at the very least minimize complications. Type 2 diabetes is a disease process that requires lifelong follow-up. Diabetic patients will need lab work every 3 to 6 months depending on how controlled they are on their medications. Some of these lab tests include an A1C, CBC, CMP, and lipid panel. They also need to be screened for diabetic nephropathy yearly with the urine albumin to creatinine ratio. They should have yearly foot exams by the provider in addition to self-examining their feet daily to assess for any injuries they may not feel. It is important to make sure our patients realize the severity of the disease and recommend that they wear shoes at all times, and if appropriate, get fitted for diabetic shoes which are more supportive for those with neuropathy. Patients diagnosed with type 2 diabetes must be referred to ophthalmology at the time of diagnosis. They should then have yearly eye exams in order to prevent or manage microvascular complications. It is important for the provider to set up any other appropriate referrals that they feel would benefit the patient. A few examples of these referrals would be a dietitian or a diabetes educator for further education and assistance with diet and lifestyle changes. Type 2 diabetes is a chronic condition that is largely preventable in many cases. This is why it's so important to educate our patients and make sure they realize the importance of implementing a healthy lifestyle early on that will have an impact on their quality of life for years to come. Thank you.